My name is Dr. Joshua Ryan, and I'm a neurosurgeon here at Northwell. I do brain and spine, but my subspecialty is in spine. More specifically, I specialize in minimally invasive spine procedures. There are many of them now that have really opened up in the past several years in terms of different options for us that give us a lot bigger toolbox in terms of operative interventions and options for people. There are certain days that we're in the office in which we're just seeing patients, diagnosing them, figuring out treatment plans. Others are in the operating room actually doing the procedures for patients. Depends on the day. I actually went to college to be a chemical engineer and decided in about 6 months that I didn't want to work in that industry. Been as a medical student, almost by accident actually. I rotated on neurosurgery and I really loved it, and it ended up being my favorite part of medical school, and so it was a relatively easy decision for me to follow that path. Initially, when I moved to Long Island, I joined a private practice, and along that way I'd become credentialed at a couple different Northwell hospitals and had very good experiences there. And so for us as a group, we knew that Northwell was going to provide us a lot more resources than we had on our own. And the facilities that have been provided to us over the past even few years are getting better and better all the time. We have a very nice neuro ICU over at South Shore, which has really been helpful for us in terms of taking care of the patients that come through the door. Them being able to provide us with such a great neuro-intensivist team there has really made our job much easier, and we can better take care of our patients. One of the things that I think is the most important in terms of taking care of patients is really involving them in their own care. There's many times patients come in, they're scared, they have a new diagnosis. Getting them involved in that right away helps them to understand what the next steps are. I think for surgery in general, but specifically for spine surgery, the real most rewarding part is seeing patients get better very quickly. But the second part of that recovery process is really helping them moving forward in their care. And so you develop this deep relationship with that person that lasts for a very long time.